All set? 002. I've been athletic all my life, and I got to the point where my knee needed to be taken care of. I couldn't do anything running wise or anything like that. I also had shoulder issues, and that had locked up to the point where I couldn't get it any higher than that. I asked my son, who can you recommend for my knee? He recommended Dr. Eric Cohen with University.
Hey, good to see you.
Hey, same here.
He came in with pain in the knee that's affecting his quality of life. He really tried some other treatment options and it failed and was kind of at a standstill. Surgery and total knee replacement is there for someone who's really exhausted everything and is at a point where they want to enjoy life, get back to activities. Told him, it's not going to be easy. Bend it and see how much he can bend.
Yep.
Wonderful. It's a surgery that involves several months of therapy and recovery, but he was highly motivated and really had a goal in mind of getting back to the things he wanted to do.
At the same time I went to university for my knee, I inquired about shoulder repair.
Hey, how you doing?
Good, Doc. How are you?
Good.
Dr. Owens recommended me to Dr. Green. I was really happy about that. Dr. Green's a very serious guy. I like that type of approach.
Andy had a type of osteoarthritis, but it's much more severe in terms of the limited mobility. His shoulder was like this, and he couldn't rotate it out at all, which presents challenges with a standard shoulder replacement. The goal was to restore his function. He wanted more mobility. He wanted to be able to be active. The plan was to do a reverse shoulder replacement because of his shoulder anatomy that would be more durable and probably much more predictable than the anatomic total shoulder replacement.
Between the two of them, they both agreed to coordinate having my knee done in January and then my shoulder done in March. And they checked off with each other because they're compatriots.
He was in a tough spot because he had both a really bad shoulder, lots of arthritis and pain, limited motion and ability to bring his hand over his head, and then also had difficulty walking. He was really limited. It required some coordination and care between him, myself, and Dr. Green.
Normally speaking, you're dealing with one doctor at a time. The nice thing about it was they're all together in Kettle Point, so one guy can talk to the other. I doubt that I'd be able to do that anyplace else.
It's great to have experts in every field that specialize just in one or two joints, and you get the best specialization at University Orthopedics. We decided to do the total knee first and then do the shoulder replacement. And the idea was that he wouldn't need an assistive aid like a walker or a cane to rely on his shoulder anymore. So we were able to optimize his time recovering and get him back to sports quicker.
The knee was done at Kettle Point, same day, in and out. And I had the shoulder done at Miriam with Dr. Green's protocol. That worked out really good too. It takes about a year for the knee and the shoulder to recover fully, but no pain, no gain. If you do everything that they tell you to do, you'll have perfect success.
You try to do what works for individual patients. Ideally, if you're going to do sequential joint surgery like that, you want to have the right kind of patient who can be motivated, recover fairly quickly so that they can move on to the next step.
I was looking for something to do after recovering. Stumbled onto pickleball here. I decided to check it out, and lo and behold, I'm doing it on a full-time basis now.
It was so special to hear that he's, a champion pickleball player.
Within a year, basically, gone from a novice to an expert. Really tells you something about him as an individual.
It's a quick game. A lot of exchanges at the net are fast, so your hand speeds have to be good. It really does keep your mind focused. I kind of kid around with people and say that I'm playing in the third period of the hockey game or the fourth quarter of the football game. But if I can get it into overtime, that's going to be the key. This is the type of sport that you can play and do that without getting these things fixed. There's no way I would have even tried it. I couldn't get the arm up above. There's no way I could hit an overhead. And the knee and being able to move around, it wouldn't have worked out.
Nothing makes me happier than to see someone either going out to doing something they've always done but weren't able to do, or discovering new things, new travel, going to new places, or even a new sport.
With the work that they did, fixing me up, they really did give me my life back. That's all the stuff I used to do. I played tennis, I played hockey, I played football, you name it. And to not be able to do any of that activity and become a couch potato, no. Not in the cards for me. I'll be pickleball from here on in.